welcome to the deep dive. Today we're digging into something really interesting. Hyperbaric Oxygen Therapy, HBO2 for short.
Right.
Specifically, how it can be, well, a surprisingly powerful tool for helping skin grafts and flaps survive and heal, especially when things get a bit complicated.
Exactly. We're talking about situations where the tissue is compromised, maybe poor blood supply, maybe previous damage like from radiation.
So this deep dive is all about exploring how boosting oxygen, under pressure,
Right.
can make a real difference. We're drawing on sources like hyperbaric medicine practice and various studies.
And it's important to say up front, this isn't usually needed for like normal healthy tissue healing.
Right. Your average cut doesn't need a hyperbaric chamber.
Not at all. But in specific tricky scenarios, it shows remarkable utility. It's actually got a long history too. This idea of using pressure for healing goes way back to the 1600s, believe it or not.
Wow, really?
Yeah, a guy named Henshaw built something called a domicilium. But the real breakthrough came much later when they figured out it was the oxygen specifically under pressure that did the trick. And eventually it made its way into modern medicine, including plastic surgery.
Okay, so our mission today is to really understand why it works, what the evidence, both animal and human studies, tells us, and what the general recommendations look like for using HBO2 with skin grafts and flaps.
Sounds good. Let's get into it.
Okay, so rationale first. Why would a graft or flap even need this? What's the basic problem in these compromised tissues?
Well, like you said, healthy tissue usually does fine. But compromised tissue often becomes hypoxic.
Meaning low oxygen.
Exactly. Oxygen levels drop way down, sometimes below 15 mmHg. Healthy tissue sits around, 30 to 40 mmHg, so it's a big difference.
And why is that low oxygen level such a critical issue for healing? What stops working?
It's a major roadblock, especially for these cells called fibroblasts. They're the key workers that produce collagen.
Collagen, right, the stuff that rebuilds tissue.
Precisely. And collagen is essential for building new capillaries, those tiny blood vessels you need for healing. Without enough oxygen, the fibroblasts just can't do their job properly. The whole repair process kind of grinds to a halt.
Okay, so the engine stalls without fuel. How does HBO2 jumpstart it? What's the main effect?
So you put the patient in a chamber, increase the pressure, and have them breathe 100% oxygen. This dissolves a huge amount of extra oxygen into the blood plasma.
Way more than usual.
Oh, yeah, significantly more. This super oxygenated blood then gets delivered to the tissues, and suddenly those starved areas can get oxygen levels boosted dramatically, potentially up to 400, even 2,000 mmHg in some spots.
Wow.
And that massive influx of oxygen directly stimulates those sluggish fibroblasts to start producing collagen again, building those capillaries. It's like giving the construction crew a massive delivery of materials they were missing.
Right, it forces the oxygen into places it wouldn't normally reach easily.
Yeah.
Now, I remember reading something about fibroblasts being facultative anaerobes. What does that mean in this context?
Yeah, that's an interesting wrinkle. It means they can function with or without oxygen, they're adaptable. There's even a theory that they might be stimulated by both low oxygen spells, intermittent hypoxia, and high oxygen spells, like hyperoxia from HBO2.
So the cycling on and off the oxygen might actually be beneficial?
Potentially, yes. The typical HBO2 treatment involves sessions in the chamber, then breaks breathing normal air. This cycling might leverage that adaptability. Some think lactate produced during mild hypoxia might even act as a signal. It's complex.
Okay, so hyperoxygenation is the main driver. But you mentioned other benefits, too. It's not just about the oxygen delivery.
No, definitely not. While the extra O2 is key, HBO2 basically supports that struggling tissue while the body tries to fix the underlying circulation problem. But it also improves how white blood cells work.
Better infection fighting.
Exactly. Boosts their ability to kill bacteria. It can also help reduce swelling or edema, improve the skin's overall health, really encourage that new blood vessel growth, neovascularization, and even help antibiotics work better in infected areas.
That's quite a list. We also saw something about arteriovenous shunts, especially in the tips of flaps. How does HBO2 affect those?
Right, that's another interesting theory. Sometimes in the distal part of a flap, the bit furthest from the blood supply, the body might create these little shortcuts, AV shunts, that divert blood away from the capillaries that actually feed the tissue.
Okay, so blood takes the path of least resistance, bypassing the areas that really need it.
Potentially, yeah. And HBO2 causes some vasoconstriction narrowing of blood vessels. The idea is that this might preferentially constrict those shunts, forcing more blood into the ischemic capillary beds where it's desperately needed, kind of redirecting traffic.
Got it. So summarizing the why, HBO2 floods tissues with oxygen, kicks fibroblasts into gear, promotes collagen, helps grow new vessels, and might even fine-tune blood flow. A multi-pronged attack.
That's a good way to put it.
Okay, let's shift to the evidence. What did the animal studies show? Because there seems to be a lot of work done there.
Oh, absolutely. The animal studies really built the foundation. For example, in rats with different wounds, HBO2 significantly cut down healing time.
How significantly?
Well, when they combined it with skin grafting, one source called the reduction in healing time startling. And, interestingly, even without sterile surgical conditions, the HBO2 groups often had no infections.
Suggesting that white blood cell boost is real.
It strongly suggests it, yeah. Better leukocyte function in action, possibly preventing those infections.
What about studies looking specifically at grafts and flaps in animals? Similar results.
Very much so. Rabbit studies showed HBO2 almost doubled the success rate for cartilage grafts, and it helped skin allografts from another animal survive longer.
Okay.
And crucially, some studies showed it really helped compromised wounds, like those with poor blood supply at the edges, but it didn't really do anything for wounds that already had good circulation.
So it targets the problem. It doesn't just boost everything.
Exactly. It seems specific to tissues struggling with hypoxia. We saw similar things in burn wound models in guinea pigs, and pigs' faster capillary formation, quicker healing of second-degree burns.
And flaps. Pedicled flaps, free flaps.
Consistently positive results in animal models. Increased flap survival, preventing tissue death or necrosis, limiting how much tissue died if it was already compromised. This supports the idea of HBO2 keeping tissue alive until circulation improves.
Was there anything about when to give the treatment? Did timing matter in the animal studies?
Hugely important. Several rat studies showed that starting HBO2 sooner after surgery or as soon as you suspect there's poor blood flow led to much better outcomes.
Right.
Significantly more flap survival.
And delaying it.
Delaying it really reduced the benefit. One key study found starting within just 4 hours of creating the flap gave the best results. Any later, and the improvement dropped off considerably.
Wow, 4 hours. That's a tight window.
It really emphasizes that early intervention seems critical to get the maximum effect.
Did they look at different pressures or oxygen levels? Like hyperbaric air versus pure oxygen?
They did. Some studies compared pressurized normal air, about 21% oxygen, with pressurized 100% oxygen. Interestingly, both improved flap survival significantly compared to just giving 100% oxygen at normal pressure.
So the pressure itself is really important, not just the oxygen concentration.
It seems that way. The increased partial pressure of oxygen you get from the chamber pressure is key. They even measured tissue oxygen levels in rat flaps, shooting way up under HBO2 at 3 atmospheres.
What about tissue that was already damaged, like by radiation, before the surgery? Could HBO2 help there too?
Yes, animal studies showed it could. It helped reduce necrosis and flaps created on previously irradiated tissue in rats.
But it can't work miracles, right, if the tissue's already gone.
Absolutely. It can't revitalize, frankly, necrotic tissue. If the main blood supply is cut off completely, HBO2 isn't going to magically regrow it. It supports struggling but still viable tissue.
Okay. And microscopically, how does it help? We touched fibroblasts, but what about the actual blood vessels?
Good question. Studies showed HBO2 actively promotes angiogenesis, the growth of new capillaries. They saw more vessels, larger vessel surface area, and capillaries growing further into the damaged zones in HBO2-treated animals.
So it's not just a temporary oxygen boost, it helps rebuild the plumbing long term.
That's the idea, yes, facilitating the body's own repair mechanisms.
There was also that study combining HBO2 with pentoxifylline. What was that about?
Right. Pentoxifylline is a drug that helps blood flow better, makes red cells more flexible, reduces viscosity. A rat study found combining it with HBO2 gave significantly better flap survival than either treatment alone.
A synergistic effect.
Exactly. Like HBO2 delivers the oxygen, and pentoxifylline helps the blood flow smoothly to distribute it, optimizing the cargo and the delivery truck, so to speak.
Interesting. And did these animal studies cover different types of flaps and grafts?
Yes, a really broad range. Simple skin grafts, composite grafts with multiple tissues, pedicled flaps, random flaps, axial flaps with defined vessels, even irradiated flaps and wounds.
And the common thread was?
Hypoxia. The lack of oxygen was the central problem HBO2 seemed to address effectively across all these different models.
Okay, the animal data looks pretty solid. Quite compelling, actually. Let's pivot to humans. What's the clinical evidence look like? Is it as strong?
It's a bit more nuanced. There's strong clinical evidence, including systematic reviews and randomized trials, supporting HBO2 for things like difficult diabetic foot ulcers and radiation injuries. Those are fairly well-established uses.
But specifically for compromised surgical flaps and grafts.
There, the picture is, let's say, built more on the promising animal data and clinical experience rather than a large number of big, definitive human trials. The support exists, but the level of evidence isn't always as high as for, say, diabetic wounds.
Okay, that's an important distinction. Any specific clinical findings on grafts?
There was a small study suggesting HBO2 might help larger composite grafts take, especially if the recipient site's blood supply wasn't great. Maybe even giving it before surgery to prep the site.
Priming the area.
Kind of, but most standard skin grafts do really well anyway, so the added benefit of HBO2 is probably most relevant when the receiving bed is poorly perfused.
Makes sense. What about those older studies from the 60s? Perrin.
Ah, yes. Pioneer work. His case studies and a 1967 randomized trial showed significantly better skin graft take with post-operative HBO2 compared to controls. Higher survival rates. He also saw better outcomes with some tricky random flaps and mucosal flaps. So early clinical signs were positive.
Good historical grounding. What about really acute situations, like limbs losing blood supply after trauma?
There's a compelling case series where vascular repairs failed after trauma, leading to severe limb ischemia.
Oh, wow.
Yeah, very serious. But initiating HBO2 therapy actually prevented gangrene in all those patients. Suggests it can be a limb saver when other options fail.
That's incredible.
Yeah.
Now, a specific area often mentioned is mastectomy skin flap necrosis. Why is that such a focus, and how does HBO2 fit in?
It's unfortunately a known complication, especially with nipple-sparing techniques or direct-to-implant reconstructions. Risk factors include things like age, BMI, smoking, previous radiation.
So common factors.
Right. And while there are ways to manage necrosis if it happens, HBO2 offers a non-surgical option to try and salvage ischemic flaps, especially in high-risk patients.
And is there clinical evidence it works in those mastectomy cases?
There are quite a few case reports showing success. Salvaging flaps that look like they were dying, allowing reconstruction to proceed. One case with prior radiation showed improvement in both breasts. Another resolved ischemia after just 5 HBO2 sessions.
So anecdotal but positive signs.
Yes, suggesting a real potential benefit in avoiding further surgery or implant loss in some cases.
What about that Bowersox study mentioned in our source? What did they find?
They looked at over 100 patients with compromised flaps or grafts. With adjuvant HBO2, they saw really high survival rates, 89% for flaps, 91% for grafts.
That sounds high for compromised tissue.
It is. Notably higher than failure rates often reported for threatened flaps grafts without HBO2. It suggests HBO2 can really tip the scales in favor of survival in these tough cases, even with comorbidities.
That's a strong clinical signal. Any evidence for even more extreme things, like replanted fingers or ears?
Yes, there's clinical evidence suggesting HBO2 improves survival for replanted digits, especially distal ones, limbs, and even traumatically avulsed ears. Situations where every bit of oxygen counts immediately.
Okay, so a wide range of applications. What about just general wound care or burns in the clinic?
Studies do show benefit in wounds in compromised tissues generally. For burns, it's been linked to better survival, fewer complications, faster healing. One study even showed a big drop in amputation risk for diabetic foot ulcers with HBO2.
Preventing amputation is huge. Let's go back to irradiated tissue again. That seems like a key clinical area.
Definitely. The evidence there is quite robust. A Cochrane review found HBO2 helps heal osteoradionecrosis bone damage from radiation, better tissue coverage, less wound breakdown. It might also prevent it after tooth extractions in irradiated jaws.
Crucial for head and neck cancer patients.
Hugely important for their quality of life. There are also reports of success in healing tissues after radiation for breast surgery, temporal bone issues, laryngeal cancer.
So it helps deal with those nasty long-term radiation side effects.
Precisely. That big review by Dowie found level I evidence, the best kind for HBO2 in late radiation injury, chronic ulcers, acute wounds, even migraines and burns. Level 3 for bone infections like osteomyelitis.
Level I is strong. But you mentioned conflicting findings for burns.
Yeah, the burn situation seems a bit complex, maybe because of the massive systemic inflammation involved in severe burns. Needs more research, perhaps? But for radiation damage, especially osteoradionecrosis and soft tissue necrosis, the benefit seems clearer.
And the mechanism in radiation injury. Why does it help irradiate tissue specifically?
It gets back to that core issue. Radiation damages blood vessels, making tissue hypoxic. HBO2 pushes oxygen levels high enough to wake up those fibroblasts, get collagen production going, and stimulate new capillary growth, that vital neovascularization. This improved blood supply is key for any reconstruction attempts in irradiated areas.
Got it. Any other, maybe less common clinical uses mentioned?
Yeah, some suggestion it might help in things like facelifts, reducing bruising perhaps, also in reconstructions around the eye or salvaging compromised facial flaps, and even some early animal work hinting it might help nerve regeneration in innervated flaps.
Improving function, not just survival. Interesting potential. Now, the source mentioned debates about animal models and the difficulty of human trials.
Right. It's always a question how well animal findings translate, but well-designed animal studies can give valuable clues. The problem with human trials on flaps is the variability. Everyone's tissue is different. Surgery varies slightly.
And the ethics.
And the ethics. If you think HBO2 helps, is it right to withhold it from a control group whose flap might be dying? It makes those gold standard randomized controlled trials very difficult to conduct in this specific area.
A real challenge. Okay, so compared to other things people have tried to boost flap survival, how does HBO2 stack up?
Well, historically, not much else has worked reliably. People tried cooling, gravity, raising blood pressure, using blood thinners like dextrin, vasodilators, humidity. None really showed consistent, significant success like HBO2 or the delay phenomenon.
Right, the delay phenomenon. Remind us what that is again?
That's where you surgically lift the flap but leave it attached for a week or two before moving it, trying to precondition it to improve blood flow.
Does it work?
It can, sometimes, but it means another operation, longer hospital stay, and it's not always ideal, especially in trauma, irradiated sites, or compromised areas. Some studies even found no benefit over just moving the flap immediately. HBO2 offers an alternative, especially in those complex cases where delay isn't suitable.
So HBO2 fills a gap where other methods might fall short or be impractical. What about the cost? Is this an expensive therapy?
That's always a crucial question. Flap or graft failure, tissue necrosis that gets really expensive fast, repeat surgeries, long hospital stays, managing complications. It adds up.
And HBO2.
A course might cost something like, say, $6,000 for 20 sessions, according to one source. If that prevents a $50,000 or $100,000 complication from a failed reconstruction, it's actually very cost-effective.
An investment to prevent much larger costs.
Exactly. One study specifically showed big savings by using HBO2 to prevent osteoradionecrosis complications after radiation.
Makes economic sense then in the right context. So finally, what are the general recommendations for using it? How is it typically done?
Usually it starts with twice-daily sessions, maybe 90 to 120 minutes each time.
Okay.
Then as things improve, you might drop down to once daily. The pressure is typically between 2.0 and 2.5 atmospheres absolute ATA.
Like being 30, 50 feet underwater.
Pretty much, yeah. But these are just general guidelines. The exact protocol number of sessions, pressure, duration really needs to be tailored to the patient, the specific problem, and how they're responding. It's not one size fits all.
Okay. So, wrapping this all up, our deep dive suggests HBO2 is a really valuable tool. It seems to improve blood supply and tissue health in many ways, helping grafts take, boosting flap survival in tricky situations, irradiated or not, acute or delayed.
And it shows real promise for complex wounds and radiation damage.
Plus, it can actually be cost-effective by preventing those major complications and salvaging reconstructions.
Precisely. It's not a magic fix for everything, but for tissues starved of oxygen, the evidence points to significant, meaningful benefits.
It's been fascinating exploring this. Amazing how manipulating something as fundamental as oxygen pressure can have such an impact. It definitely leaves you thinking. Given all these benefits and the growing evidence, how will HBO2 become more integrated into routine surgical and wound care for these compromised tissues in the future?
Yeah.
And what research could really help us zero in on how to use it best to maximize the impact for patients?
Good questions to ponder.
Definitely something to think about.
Yeah.
Thanks for joining us on the Deep Dive.